Hi, everyone. My name is Alex Hess. I'm the Legal Training Manager at the Center for Public Health Law Research, and I'll be moderating today's webinar. I'm very excited to have our two guest speakers presenting today, Jonathan Larson, my colleague at the center, and Robert Osby at the Florida Health Department. And today's Legal Epi at Lunch session is covering institutional policies. And through their projects, they'll be highlighting some of the unique perspectives, challenges, and insights that they've gained working on these projects. But to start, I want to make sure I cover the policy surveillance process at a very high level. Generally, this is probably a graphic you all who are joining us today are very familiar with, but just to reiterate, this is the policy surveillance process. It's a process that we follow in doing our legal epi work, starting with defining the scope, conducting background research, developing our coding questions, collecting the legal or policy text, coding the law, and then finally publishing and sometimes tracking and updating laws and policies over time with quality control embedded in every step of the process. We often teach policy surveillance from the perspective of tracking things like state or local level policies, but policy surveillance can also be applied to a wide array of different types of policy or rulemaking. And so that's what we'll be talking a little bit more about today. So where can we use policy surveillance? Well, really, we can use policy surveillance anywhere there is some measurable rulemaking authority that varies from one jurisdiction or institution to the next. So policy surveillance is used, and we often use this for things like state statutes, regulations, local ordinances even. You may have also seen some of our work or data sets where we incorporate things like case law, attorney general opinions, or executive orders, for example. But policy surveillance can also be applied to things like international agreements, board decisions and rules, school district rules, healthcare system policies, and also things like higher education institution policies. And so you'll be hearing a little bit more about those projects today, but these are just a few examples of how policy surveillance can be applied, not only to governmental level policies, but also at the institutional level. But in making this data, there are some unique research challenges that we might face, including things like identifying effective dates, which is a really critical aspect of doing policy surveillance. If you're tracking changes in law and policy over time, it's really important to know at what point in time those policies actually go into effect. And while this tends to be a more straightforward aspect of the research when we're doing, statutory level or regulation research. If you're looking to things like Westlaw or Lexis or state legislative websites, often the effective date is listed right there for you. But if you're trying to track down policies, let's say Board of Regents policies, that might not always be the case. So that can be something difficult just in terms of practical challenges when you're trying to do this research. Also, obtaining historical copies of policies. Again, oftentimes on things like state legislative websites, you can go back in time and find old versions of a particular law. When you're doing this at an institutional level, those documents, those versions of a policy might not always be readily available. You might also face fewer secondary sources or databases and supplementing your research, and this can create other challenges as well, just in terms of supplementing your own team's research, double checking the work that you're doing, and also understanding the role of implementation. Oftentimes, we have a better understanding of how something like a statute is going to be implemented or carried out. At an institutional level, sometimes it's unclear how those policies are actually put into effect. Some other important factors to consider when you're looking at institutional policy data are making sure you have subject matter experts that you can refer to who are very familiar with the particular topic you're researching. Also, understanding the interaction between some governmental legal authority and the institutional policies you're researching. Is there, for example, some kind of authorizing state level statute or some kind of state or federal policy that has a role to play in how these institutional level policies are being created and carried out? And also just considering the number of institutions or jurisdictions you might be researching. There may be thousands of institutions that you could potentially compare, but that might not be very practical for the research project that you're doing. So you might need to consider how you would have to narrow that down. And these are just a few of the considerations that I wanted to highlight, how it can vary slightly from doing policy surveillance with governmental level policies. But our guest speakers today will talk a little bit more about the specific and unique challenges that they face doing their own projects. And I also wanted to quickly touch on Monocle, which is the legal coding software that we've developed here at the center, specifically for the purpose of doing policy surveillance. And some of you may be familiar with Monocle, you may be using it yourselves. Monocle can be used not only to track things like state or local policies, but can also be used at the institutional level as well. So I wanted to just make sure I highlighted that and quickly show you how simple it is to do that. So this is a screenshot of a page on Monocle when you're creating a new record. So adding a record for a new jurisdiction or institution is really easy using Monocle. When you're adding a new record in Monocle, each jurisdiction or institution has its own record or a series of records in a longitudinal data set. You'll select the appropriate jurisdiction level by clicking this drop-down box next to Find Place. So you see here, there's countries, states, cities, counties, and also that custom option. So you can create, whatever jurisdiction or institution that you might be researching. So really simple to do this using Monocle as well. And now I'm going to turn it over to our speakers who will be talking a little bit about the projects that they've led. 340B hospital policies, opioid court settlements, and Florida school district tobacco policies. First, we'll be hearing from my colleague, John Larson, who is the legal technology manager here at the center, where he supports expanding use of scientific legal mapping through Monocle, a software tool to support teams as they navigate and organize complex legal text to produce legal data for use in research and practice. Mr. Larson's research focuses on drug policy and access to healthcare. Prior to joining the center, he was a health policy consultant providing federal and state legislative and regulatory analysis for biopharma clients. He has broad health policy experience, particularly in oncology, having served in policy roles at the American Society of Clinical Oncology and the National Comprehensive Cancer Network, where he also managed international business development. Outside of oncology, he has worked on public policy initiatives at the National Osteoporosis Foundation and was a senior compliance specialist at PerformRx, a pharmacy benefit management company where he applied deep expertise across the continuum of Medicare Part D issues. Mr. Larson has worked on issues related to biosimilars, molecular testing, the use of health data, medical guidelines, cancer prevention, health disparities, access to care, payment reform, and the initial rollout of the Affordable Care Act. So John will be speaking with us today about both the 340B hospital policies and opioid settlements projects. And next we'll hear from Robert Osby, who has worked for the Tobacco-Free Florida at the Florida Health Department for 10 years. Originally as local tobacco prevention program manager for a county health department before transitioning to state level role in 2017. He currently serves as a statewide policy manager responsible for coordinating policy systems and environmental change interventions at the state and local level. In this role, Robert develops and manages policy initiatives for community-based tobacco prevention programs in each of Florida's 67 counties. Under his leadership, TFF's community-based programs are gaining traction in the effort to establish comprehensive tobacco-free school policies across the state. He also oversees Florida's online tobacco education courses for students, educators, and nurses provided through the School Board of Palm Beach County's Tobacco Prevention Program. Robert is particularly passionate about establishing collaborative partnerships across agencies, sectors, and state lines to advance key tobacco prevention objectives. So Robert will be sharing more about the project he leads tracking school district tobacco policies in Florida. So without further ado, I will turn it over to my colleague, John, and I'll be advancing your slides today. So please just go ahead and let me know when you're ready.
Thanks so much, Alex, and really happy to be here today to talk with you all about some of the novel challenges that arise when we are not doing traditional statute and regulation based research. I am here to talk about specifically how we addressed hospital policies at 340B eligible hospitals, and also talk about the work that we've done on opioid litigation proceeds. That focuses more on the tension between not having a complete picture of the legal landscape if you're only looking at one piece of policy or law. So, next slide, please. So we're going to start by talking about hospital policies, and many of the things that Alex already mentioned were really critical for how we framed and approached looking at these policies, where we were starting in a place where we didn't truly understand how accessible the policies might be, what the challenges of actually accessing those policies could possibly be. We're used to a universe where we go onto Westlaw, LexisNexis, and automatically we have reliable research coming back to us. We know that there are huge teams working on updating as new bills become law and become effective. Um, that we can rely on that kind of data. From my previous role in compliance, I'm very familiar with updating institutional policies, updating healthcare related policies that will internally have effective dates that are enforceable in some capacity, right? So these are things that we can see that will influence behavior, and that's where our existing monocle tool continues to be relevant outside of the realm of traditional research. Next slide, please. So I want to just get us situated in understanding what the directive was, what our project's goals were. So we started with understanding that there is a statute, the Public Health Service Act, Section 340B of that act essentially establishes a drug pricing program for qualifying hospitals and clinics that requires pharmaceutical manufacturers to give discounts based on a statutorily set ceiling price on specified outpatient drugs. So things that you can get at the pharmacy. The program was originally intended to help hospitals access discounted medicines to treat low income or otherwise underserved communities. And under the 340B program, hospitals may expand their existing services for patients with low income by allowing the hospital to pass along cost savings on pharmaceuticals to patients, among other service expansions. However, there's no specific requirement in the law that the savings from this discount program are directly passed on to patients or insurers. So it presents itself with a novel situation of how can we see how hospitals might be passing on the savings that they get to patients. What kind of policies do they have currently that address patient affordability? So we're thinking about what triggers free care, um, what protections might exist within policies regarding debt collection actions that might be taken at a hospital. So there are a lot of different ways to think about this and a lot of different policies that we needed to essentially consider and learn about. So uh, under this framework, we discovered that in order to qualify for non or 340B status, a hospital needs to do certain things that we could understand and track, which would help us to scope out what the universe might be for our understanding. So next slide, please. What we ended up doing is I'm going to take a step back for 1 second because something that Alex raised earlier is actually really important. So, what are we supposed to document? What can we document? And what is our universe? Because if we're talking about hospitals, we're talking about thousands upon thousands of institutions across even within a narrowed space of 340B hospitals. There are still thousands of hospitals for us to potentially look at their policies. So we ended up narrowing our scope to the 75 largest 340B hospitals by revenue. So we needed to have some type of target because if we're doing a 50 state analysis plus DC, as is per our standard state policy surveillance project, that's pretty tightly compacted. We know what the jurisdictions are. In this instance, we really needed to select something that we felt could be representative of a lot of the patient financial assistance policies in the country, and having those high revenue hospitals as a target was an important decision point for how we address this. But going back to what can we actually base our analysis on, we ended up seeing that IRS regulations require hospitals to provide certain information, which would be a really helpful gauge on what kind of questions we could ask of existing policies. So before we started any real analysis of existing policies, we knew that they had to require these certain things. So indication of which providers the financial assistance policy applied to, which hospitals it applied to, what the eligibility criteria of the financial assistance were for folks. And that is very, very divergent. It varies from hospital to hospital. State law often sets standards on what requirements exist for financial assistance, and then that would be reflected back to us through the policy. So it's an interesting thought exercise. Um, the method for applying to financial assistance is very important, how difficult that method is, whether or not folks need to provide a lot of information when they're applying. These become things that we can ask questions of the policies that will help us to see what the differences are between the hospitals and where there are greater patient protections and there are situations where there are lesser patient protections or no protections at all. We also need to understand in this context the basis for calculating amounts that are charged to patients, which is an important aspect of how they qualify for financial assistance. And then whether there's an absence of a separate billing and collections policy, and where that exists. So we actually needed to figure out whether there was a billing and collections policy. So it really became two data sets combined into one, where we're looking at two different sets of policies in many instances. So next up, these are just some examples of what we found. So we established that baseline where we understood that hospitals were required to have written policies. So we knew that if we went online, we're likely to find them. So we knew there would be a viable search strategy to actually get policies. I will say that my colleagues and I ended up having to do a lot of phone calls and emails to locate some policies because the brass tacks of the IRS regulation says that they have to be made publicly available, did not really say it needed to be publicly available on a website. And ultimately, we found 74 of 75 possible hospital policies. This is something you have to think about when you're scoping out a project, how much actual time is going to be spent on that research piece where you can really understand through Westlaw or LexisNexis that you're going to be able to go on, have valid information, how much time you're going to be spending on phone calls and just sifting through websites. We actually developed in a piece of our technology to our technology portfolio here to help us with the search function, just so we could really target and kind of cut out some of the noise that was happening in a typical Google search. Um, so from this experience, we're actually able to document all of these legal questions that we came up with across all of these 75 institutions. We did encounter novel issues where we have parallel records. This is something that can happen when we're doing a legislative analysis where you have multiple bills happening in the same jurisdiction in the same time frame. So this is our legacy monocle where this is published, and we can see there are cities where you actually have multiple hospitals, and you know that if you click on that, you can see questions for multiple hospitals in an individual city. Um, this is this was a lot of work to figure out how to best express this information, and it's just typically it's different than our standard 50 state analysis, certainly. Um, this is one of the outcomes of the study itself, where we looked at what the federal poverty guidelines were limiting the federal poverty guidelines were to establish and qualify for free care. You can see a large amount of variation on the ends here. There are some hospitals that are in states that only qualify at 0 to 100% of the FPG. You have a couple states that are, or a couple hospitals that are much more generous, right? Um, Allowing for free care for folks who are above 500% of the FPG. So this is the kind of takeaway you can get from this kind of analysis. Um, Encourage anybody who's interested in this to take a look at. Actually, can you advance the slides? I already yeah. Sorry, I was talking over slides that I'm looking at here. So this is this slide that Alex just pulled up. That's the map overview and the parallel records of the hospitals. And then next slide, please. This is the chart that shows the federal poverty guideline limits to qualify for free care. And you know, this is an important kind of lens that we're able to see on what hospitals are doing. They have a lot of control to determine what these standards are. Some, like I said before, some of it is state statute based, but you can have much more generous policies or much less generous policies depending on where you are. So there's disparities in how people access free care. Next slide, please. So the other piece of this that I mentioned, we got into this pretty deeply. We had to answer questions too about debt collection policies. Now this kind of lends a mirror from a compliance perspective to existing state laws, because if you're functioning within the umbrella of state law and what they direct for debt collection, especially around medical debt, that's going to impact what these policies are. So we have a snapshot of a mirror onto the statute here. And this is a really interesting piece of the puzzle. We also did the same process of what can we ask of the law, or what can we ask of these policies, and what do we base that off of? So we did the same kind of process where IRS requirements were really helpful. Other kinds of federal protections that exist for patients who are experiencing bankruptcy are also important in this context. So we're able to analyze where hospitals were potentially much more aggressive with debt collection, where they had self-limited what they can do, which provides more patient protection. So I am cognizant that I have about 5 more minutes. This was what the main piece of my presentation is, but I want to move on to the next slide to talk a little bit more about what we do when what we can capture is not really the full picture of the law. So we produce a data set that looks at state laws that directs opioid settlement litigation proceeds. And what we determined from this process is that the court settlements themselves are really important to determine the amounts, some of the limits on how the money can be spent, all of these things. And in order to do that, it would have required us to go into a non-traditional pattern of research, just like I described in the hospital policy collection piece, where we'd have to figure out how to get access to some of these settlement agreements, go through court records, and we ultimately narrowed our scope of the project to focus on state law itself. So next slide, please. We narrowed the scope to focus on state law itself to provide that baseline of what the states are trying to control. So the states were really, really focused on avoiding the mistakes made during the tobacco settlement in the 90s, where a lot of that funding reverted to general funds, was not used for tobacco cessation, filled budget gaps. The states do have control on really making sure that the funds can't revert back to a general fund, that they can organize their own trusts and council structures to make sure that the funds are uh, sent out in a way that is more equitable. So the states do have certain amount of control, and we can reflect that through our standard uh, policy surveillance. Uh, but if the state law also addressed memorandums of understanding and the actual settlement itself, we would also build in the settlement and code against the settlement, because the statute made that into the driving force for some of the answers that we were asking. We also used, in this context, um, model legislation to help us design our questions and answers, which was an extremely helpful and interesting process that allowed us to focus our attention on things that we thought, uh, based on expert opinion, would be helpful for states to implement to help avoid those falls of tobacco cessation. So next slide, please. So just as an overview here, we see 40 states and the District of Columbia, I believe, have laws that specifically are directing the utilization of opioid litigation proceeds. In absence of these additional controls, the states in gray are really functioning in a space where the settlement itself is the directive, and that's all there is. Um, there may be some other structures, but as of December 1st, 2023, when we had validated this data and done our research through, this is where the states had actually implemented state law to help direct that opioid funding. Next slide, please. And then we also have the great variation within the states around how they set up their councils, how they set up their trusts. I know in West Virginia, as essentially a separate non-governmental entity was set up um, as a kind of a nonprofit structure to get out settlement funds. So there are a lot of different ways that the states could be doing this. And my colleague from Penn State couldn't join us today, but we're working on kind of closing the picture. A lot of people on this call are probably aware of a lot of the national settlement work that's been done to try to really focus in on different aspects of understanding this space. We're trying to use the policy surveillance piece that we have done at Temple and integrate that with a better understanding of the settlement agreements and writing up a paper where we can think about best practices that can be derived from different structures that are implemented. And my timer just went off for 20 minutes. So I think I did pretty well in getting through the content. I'm really happy to talk about it more, and I'm really excited and interested in hearing more about what Robert has to present.
Thank you, John. I'm going to turn it over to Robert, but John's contact info will also be at the end. I just want to make sure we have time for Robert's presentation and to get to any questions. I see a couple of questions have come through in the Q&A, so we'll do our best to get to those at the end. All right, Robert, I'm going to turn it over to you and go ahead and let you share your screen whenever you're ready.
Sounds great. Thank you so much, Alex. So as Alex said earlier, my name is Robert Osby, and I'm a statewide policy manager for the Bureau of Tobacco-Free Florida. We are Florida's statewide tobacco control program. And more specifically, the portion of the program that we are going to be discussing today is state and community intervention. So as you can imagine, depending on which state you're in, you may have seen media campaigns or things like that. But what we're talking about is people working in communities to really advocate for policy or to empower community members, youth to advocate for policy. And when you're doing that work, it really helps to have a concrete baseline of data when you're going out and encouraging institutions to adopt stronger policies. So that's kind of where we're coming from with this presentation here. A little bit more context for us. I, particularly within Tobacco-Free Florida, as I'm sure you guessed by now, focus on school policy initiatives in every single county throughout our state. Something to point out about us in state and community interventions: we are not researchers, we're not analysts. We're community mobilizers who rely heavily on data for storytelling and strategic message development to get policies adopted. So that's really kind of the angle we're taking as we're approaching the policy surveillance process. Now, we do, as Tobacco-Free Florida, we have a grant-funded tobacco prevention program in all 67 of our counties. They are tasked individually with advancing community interventions, policy-based interventions, to drive down tobacco use and prevent youth or young adult initiation. We also happen to have one school district per county. So we have 67 programs, 67 county school districts. And this is a nice little advantage for us because it means that one of our staff in one county has the ability to research their own jurisdiction that they work in. And then we can kind of pair them together for redundancy with people working in other counties. So in other words, your coders are going to have much more familiarity with the actual policy in their jurisdiction, you would hope. But that being said, as I said before, we're mobilizers. These are people who are public health practitioners focused on coalition building, these types of things, not always with very strong policy expertise. So it's kind of all over the map. And to account for that, as we put together our process, we had to figure out how we can, really take advantage of beefing up coding review and implementing additional, for example, supervisor reviews on records so that we are making sure that the increased likelihood for error is not making it, those errors that are more likely to happen with coders that are less experienced, that aren't doing this as their main job. Those errors are less likely to make it through with some additional checks. But essentially, as I alluded to before, we really needed concrete data to remove any guesswork on the part of our community staff and their partners, right? That was a big issue that we had when we got back into working on school-based policy. It's that many of our staff, as I said before, they're not necessarily all policy experts. You kind of have a wide range of expertise. And we had some issues with just misrepresenting, misinterpreting policy, and it was, impacting credibility, right? If you're going to a school board and you are asking them to update the policy and you can't even really tell them what the policy is now, that's not a good starting point, right? So that's really the entire reason that we started doing this, is that we can have data that we can rely on, that we can look back to, that there really is no guesswork for my staff. They can go look at what the policy status is at any point if they need to, and they can take that and apply that in their messaging and strategy going forward. So as I kind of talked about but didn't say directly, our team essentially consists of me as the supervisor, and 67 coders, one for each county. And I've also been very fortunate to have some support staff or college interns who have been really interested in policy analysis and policy surveillance, who have come in and been a huge help to do this. But really, to make this process work for our organization, we had to make a lot of changes, which I'm sure you're gathering already. So I want to address some of the changes that we had to make to the process and kind of what that means for us. First of all, we don't batch at all. It's not really something that we can do. Instead, we rely entirely on coding review to identify necessary changes to the code book, right? So, any question changes, anything like that, it's all going to come out of coding review. And we tend to compile that over time and then apply it all at once, which we just did last summer with an updated code book. And then every jurisdiction is researched on a quarterly basis. So every single county is getting searched every single quarter. So if you miss something in quarter one, you may catch it in quarter two. We also have redundancy there in the research process as well. So it's being searched twice. The jurisdiction itself is being searched twice every single quarter. So that kind of makes up for the lack of, batching, where you have everything kind of in front of you and you can troubleshoot in between batches. For us, we're really just making sure that we are continuing the research on a consistent basis so that even if we do miss something, even if there is an error, we can correct for that soon after. The tools that are used. So we had to really modify a lot of the tools that are used by the Center for Public Health Law Research for our purposes. Instead of a master sheet, legal text, amendment tracker, we really consolidated all of that into one tool that is used by the coders, the researchers, coders. That's called the policy tracker. And I'll start sharing my screen now, if that's all right. Let's see. So this is what it looks like right here. You'll kind of see all the elements of your typical master sheet, amendment tracker, policy text or legal text down here, but it's all put into one document just to, again, minimize as much as I can the error from having so many different people involved in this process, making technical tweaks to Word documents. It's just much easier to keep it all in one place. So let's see. Also, getting everybody on a monocle. With 67 counties, her turnover is pretty high. So that is one of our challenges, absolutely, is making sure that everybody has access to actually code when it is time to do so. And then I think that's pretty much all the big changes. I mentioned the additional supervisor reviews that we've implemented. We do one before coding review and one after. And I have at times, if as we've kind of been transitioning the data set, I've at times even introduced additional redundancy for the coding process. So for example, you have your record, your cloned record, your two coders are redundantly coding those. I would have a third copy of the record that I myself as a supervisor would code and then compare that to each coder. I'm not doing that now. I feel a little bit more on solid ground now in terms of our ability to do this well. But that is something that we've done before, and that is certainly one way to hopefully catch more of those errors, although it does increase the supervisor workload quite a bit. And that is probably the first big challenge, is that for me, the workload is very high because I've kind of taken a lot of the typical responsibilities that a normal researcher would have and just moved them over to the supervisor role. So my staff, they only research policy, they update the tools, they code. That's it. I do all the record management, policy building, all of that stuff. It's actually okay now. It's quite manageable now, but for a while there, it was pretty difficult because it just so happened that when we started collecting these data in 2021, we were here, right? So in Tobacco-Free Florida, we have criteria that we're really looking for in school board policy. We call them the 15 comprehensive policy provisions. This tells you how many of those provisions have been adopted in this county at the point in time we searched in 2021. So this is where we started our cross-sectional data set that we first started with. And then just 3 years later, here we are, massive amounts of policy change. More than 50 of our 67 school districts adopted policy. So while we were trying to figure out this whole process, a ton of policies were changing and we were trying to keep up with that. So I think I'm still a little suffering from a little bit of PTSD from all of that process. But that is one thing to keep an eye on if you are expanding this process or want to use it within another organization. It is something you may need to be prepared for, that the supervisor may need to take on additional roles because the researchers themselves, they may not be that full-time professional researcher. They may have another job entirely, and this is a side project for them. Now, some benefits of this, though, are that we are able to systematically surveil all 67 of our jurisdictions 4 times a year, which means that we can rapidly identify policy most of the time, unless we miss it, which again, we'll catch it 3 months later, hopefully. Also, this process and the resulting data has benefited our program massively. Policy status knowledge, like I talked about before, just being able to accurately refer back to that has been huge for us and has really cut down on those kinds of issues entirely. And just personally, I think it's really important to enable this type of policy surveillance to be conducted by others. I've noticed this space is there's a lot of JDs here. There's not too many people like me that just working in other fields that really can do some pretty cool stuff with this process. And I would love to kind of contribute to finding ways to expand it beyond because it was very cool figuring out how to apply it to a state tobacco control program. When it comes to the institutional policies that we're surveilling, I'm checking the time here. I'll just take a couple of minutes to talk about that. School districts, I heard a lot of similarities in what we are kind of figured out with Jonathan's presentation earlier, because you don't have like centralized locations like Municode. If you're looking at municipal policy or LexisNexis, you just kind of have to figure out how each school district publishes their policy, and they all do it in different ways. So you've got to kind of figure that out. You may need independent search strategies for every single jurisdiction, and so it does help to be able to have essentially one researcher per jurisdiction, because you can kind of crowdsource that and it'll come together quickly. But that was definitely a challenge for us. Also determining what really is policy and what should be captured by this. We originally started by looking at school board policy. School board policy is really what's governed by statute. Those are the policies that school board, they've got to follow a specific process in order to adopt those policies. It involves public review, public comment. All of these things have to happen in order to get a new policy in the school board policy manual. Not necessarily the case with other documents like the Code of Conduct, which is more of an administrative procedure document, a rules document. We originally included Code of Conduct in our, we considered codes of conduct to be in scope. That turned out to be, I think now, a mistake looking back, because it was so difficult to actually capture the text from a 100-page code of conduct, just the pieces that you needed. And then that changes every single year. So every single year you're recoding, you're researching. So that is something that I'd love to kind of learn more from people like Jonathan, is how to actually take these other supplemental things like settlements, or in this case, like a different type of document, and somehow incorporate that without making things too difficult. I think I should probably wrap it up there. I'm happy to answer any questions you guys have about how we've done this, or maybe what was different about. That's one thing I didn't talk much about, what's different about actually searching and coding school district policy as opposed to state statute. So happy to answer any questions you all have.
Thanks so much, Robert. I'm gonna go back and share the rest of my slides. We do have some time for questions. I see a couple in the Q&A, so I'll be sure to get to those, but let me just pull this up on my screen really quickly. So there you have my email, John's and Robert's as well as our center social media. And I'll go ahead and leave that there for a moment or two. You can also scan the QR code as well. I think that pulls up our link to our newsletter, if I'm not mistaken, but the link is right there. As a reminder, these slides will also be available in the recording. So please feel free to reach out if you have any additional questions after today. And I saw a couple of questions about this in the chat, so I'm going to go ahead and share this really quickly as well. As a reminder, we have our Policy Surveillance Institute. That's our annual workshop, 2-day workshop, covering policy surveillance at a really deep level. So if you haven't attended, or if you're not as familiar with the policy surveillance process, highly recommend checking that out. The link is listed here on my slide, but you can also go to our webpage to find more information. It's August 7th and 8th of this year, and that's held in person in Philly. All right, so to go back to our questions for our speakers, I want to start with those that are in the chat first. We have a question. I think this is about the 340B project, but please correct me if I'm mistaken. I'd love to hear more about the search function or search tracking function. I believe you mentioned that briefly, John. If you want to go ahead and take that question and talk a little bit more about how you developed that sort of search tracking tool to supplement your research for the 340B project.
Yeah, thanks, Alex, and thanks for the question. I think I had mentioned this when I was going through. Um, so basically, we had factored in a small additional piece to support a technology uh, solution to just the fact that when you go into a standard Google search and try to figure out um, what which links are going to have policies, what is going to work. We were running into, well, this is pretty time consuming. So we worked with our tech team internally. Now, this is not something we made publicly available after the project, but we learned how to essentially use some of the filtering functions within um, Google search to limit the universe for us. So to feed in, what are our jurisdictions, and it helps to return results that had policies attached to them. And we were able to use that as kind of an internal tool to help augment the yeah, thanks for getting the video back on, but I guess we're still screen sharing. Um, so essentially, our client was able to use this too as a internal tool to search for the kind of policies we're interested in. It wasn't super complicated. It wasn't like a software program that we can use more broadly. But sometimes it's interesting to think about what the other how to refine existing search, because we all start with Google, right? If we have a question, we want to have a quick answer. AI features are already being integrated into standard searching and things like that. So we're doing a lot of work in our technology program to start to integrate uh, evolving tools. Um, yeah, that's right, Kate. It was sort of like a Google custom search um, that that we had developed. But stay tuned. We have a lot of exciting features. Our new platform, Law Atlas, where we actually publish the data sets that we produce in the back end with Monocle, was first launched back in the, I think, summer of 2024. Um, and we are currently working on an importer tool. So if you have existing data in an Excel spreadsheet format, there's a way to actually work and plug that in that will actually auto populate. So we're really excited about that too. So I just wanted to point out some of the other technology features that we've been thinking about. So thanks for that question, Kate.
Thanks, John. I'm just looking again at the chat. It
Oh,
looks
I,
like
I am not sure the answers to that, Kate. I can check. I'm not familiar with Perma CC.
great. Thank you. I have a question. I'm just keeping my eye on the chat here. Looks like there's a follow-up question for you, John. If you do a project like these ones as a snapshot in time, and then you come back a couple years later to do it again, does it take the same amount of time or does it get faster as you do more? Well, really, that's a question, I think, for either of you.
Yeah, I can start and then turn it over to Robert. So yeah, this is cross-sectional. The real problem for making this kind of data that we did for the 340B project specifically into the longitudinal data is that there is no continuity in processes for hospitals logging the changes in their compliance documents. We actually do have funding in the works now to update this project, and we're essentially going to do a new cross-sectional data set because of that limitation. where it's unclear when they delete a policy. There is a tracking feature within the policies. It says effective dates, but we wouldn't be able to actually figure out what's happening with greater certainty. So I'll turn it over to Robert for his thoughts.
Yes, it absolutely gets easier. At least how we've done our project, it gets a lot easier over time. But we did start with a cross-sectional, I think only because, well, I guess I can just start from the very beginning. So I learned about this process through a learning collaborative with Temple and the Geographic Health Equity Alliance. And that project was to create a cross-sectional data set. And in doing that, I decided I don't want this to be cross-sectional. I'd like to keep doing this. And that's where the whole project kind of really started. So I didn't really take that break. So that's my little disclaimer there. I kind of took the cross-sectional and was figuring out all along how I was going to do that going forward. But yes, it got a lot easier. And especially once you figure out your process for locating those policies or legal text, that was a lot of the startup process for us. Is just, how do you figure out, and not only do every school district do it differently, but they may format their policy manual completely differently, right? So even within that, it's hard to find. And I was able to create a custom search strategy for our staff so that, because we have one person searching every county, the first time they went in, they pretty much put step-by-step how you locate the policy for that jurisdiction. Every quarter we go into search, we update that search strategy too. So that's kind of how we make sure we're keeping up with it. But yeah, that's really not an issue, not something that takes as much time for us anymore.
Thank you both. This is maybe a good segue to a question for you, Robert, but in sort of working with you on the evolution of your project, you've developed a lot of, and as you all got to see, some really helpful tools that sort of adapted all of these methods into tools that were most helpful for your team, especially given that you're managing such a large team, which is not something that we typically do at the center. So there's definitely been a lot of cool developments in how you've managed this project over time. So how do you anticipate your own process evolving in the future as you continue to do these updates? And what are the improvements that you would like to implement over time?
Yeah, well, the big one is getting away from that combined Word document tool. I would really love to make that a little bit more automated online, something that guides the the person a little bit more through what to put in there and where to put it, because I'm sure you can imagine with almost 70 people doing a Word document, varying technical capacity there, it just sometimes becomes a big mess. And half the time I may end up going back and fixing things for them, and it really, it's just not a very clean process right now. So while it's good for us because it's avoided the confusion of having multiple tools, just having a Word document tool with that many people, turns out a lot of potential for error there, and something I'd like to mitigate going forward by hopefully going online with more of a structured tool.
Great.
But that's the big one. I mean, otherwise I'm kind of reevaluating every single year. We just changed our code book. I think we're down a place where that's going to be good for us, until we learn of some new policy constructs that we have yet to conceive of. But I feel like we're in a pretty good space right now to move forward, and just a matter of maintaining, keeping my staff trained. Yeah, I think we've worked through most of the kinks, Alex.
Cool. Thank you. Yeah, it's super helpful just to hear how you conceptualize these projects so differently. Even though you're applying a lot of the same methods, it can really look vastly different just depending on the project needs, the time, the resources, who's working on it, and just logistical things like you both have mentioned. Oh, sorry. Hearing an echo, I think it went away. But yeah, just sort of those like general finding, like John mentioned, like it's hard to track changes over time. But can you do a single cross-sectional update of all of the policies, annually or something like that as a way to sort of get around that issue that we don't necessarily always see come up when we're just tracking like statutes, regulations, and so on. It looks like we have maybe time for one more question. Let me look and see if there's anything else in the chat. Not seeing anything. So I'll turn it over. Oh, and I see that Bethany has shared links to all of these projects in the chat. So thank you so much, Bethany. You can go to lawatlas.org. She shared the links to each of these projects on Law Atlas and our other database, PDAPS. You can also go directly to either of those sites to check out the data sets that both John and Robert have worked on there. Okay. Okay, really quickly, one last question. I will pass this to you, John. So how do we determine whether policies not captured in traditional legal research tools like Westlaw or Lexis can be effectively researched? And you might have spoken to this a bit, but I don't know if there's anything.
Yeah, I mean, I can reiterate some of my prior thoughts on this and reframe it a little bit. But the the one piece of scoping out a project is that's super important to the whole effort is, can we even research the policies? There are things in, say, Medicaid, where some things live in a black box, where we would have real difficulty trying to get access to some of the policies that we need. And if you identify that up front, then you can build that into your research protocol and build it into the scoping. Like for the hospital policies, the original question we had is this even something we could validly research? And I had enough confidence after understanding that there was a legal obligation for hospitals to publish this information, that it's not going to be a strange thing to be asking, or that it would be behind a black box. So that's really important at the outset to figure out when you're looking at policies, whether or not you can even get access to them, because there are some things, like it would be really hard to, proprietary contracts, things like that. There are real barriers that would exist to doing this kind of work in some type of different legal spaces. That's sort of a more obvious one, but I could think of other kinds of policies that are not governed by an IRS regulation where you would not be able to find them.
Yeah, we have a similar dynamic for the school board policies that are required to be posted publicly. And if not, we might not be able to do this at all. And we're noticing that like codes of conduct are also required to be published, but other procedural documents, not necessarily. So as we're interested in reviewing those and analyzing those, it's been a real challenge figuring out any sort of consistent way of doing that. Yeah, I would echo everything you said.
Great. Thank you both so much. Thank you all for joining us, and thanks again to Robert and John for sharing some insights on the projects that they worked on, they're continuing to work on. Please, again, feel free to reach out if you have any questions that we weren't able to get to, and this recording will be available. Have a good weekend, everyone.